Welcome to the University of Washington Breast Imaging Program, located at the Seattle Cancer Care Alliance. The Seattle Cancer Care Alliance is located in South Lake Union and is a collaboration between the University of Washington, the Fred Hutchinson Cancer Research Center, and Seattle Children's Hospital. The Seattle Cancer Care Alliance is a tertiary cancer center for the entire Pacific Northwest. Hi, I'm Dr. John Scheel, Fellowship Director and Residency Site Director for Breast Imaging.
And I'm Kat Derensberg, team coordinator with the breast imaging team. I work in the film room and I process imaging from outside facilities.
The breast imaging clinic is located on the 3rd floor. We're going to take you on a tour of our clinic, starting with a patient check-in counter. I want to emphasize that we provide multidisciplinary care at the SCCA, starting from the moment the woman checks in. From this counter, they have access to all clinical services across the continuum of care.
This is where patients will enter into the imaging clinic. As soon as we walk in, we have the cabinets for gowns. On the left side, we have 4 new mammography units from GE and Hologic, all of which have 2 changing rooms per unit. As you can see, patients are able to change and then able to go straight into the imaging room where we have one of our technologists, Suki.
This is one of our 3 Pristina mammo machines. We also have a Hologic mammo machine that we use for stereotactic biopsies and also extra screenings.
This way is the gown waiting room where patients are able to wait for an ultrasound room to be available. Here we have our nursing station where vitals are also able to be taken. At the end here, there is also one additional changing room for patients to utilize. On the right side, we have 3 ultrasound units, and then as we go down the hallway, on the left, we have our tech area. We have 4 mammography rooms total. All of our units offer tomosynthesis. However, the 4th room has the added capability of stereotactic and tomosynthesis guided biopsies. In the future, we anticipate adding a portable ultrasound unit to facilitate multimodality procedures. At the end of the hallway, we have our reading room, where our radiologists are able to sit down and look at imaging, and I'll pass it off to John.
Our reading room is separated into 2 separate components, with diagnostics and procedures in one area and screens and MRI in the far reading room. But we have an open door policy where radiologists from both areas collaborate in interpreting films, providing second opinions to improve efficiency and patient care.
Hello, I'm Sarah Anderson. I'm one of the current breast imaging fellows, and I'm going to talk to you about our procedures, which we do for a week long, every 3rd week. This is the desk specifically designated for the procedure person, and our day starts at 7:30, and what you do is you come in and you prep all of the cases to run through them with the attendings. First case starts at 8, and then we go all the way till about 5. There are 2 slots during the day that we leave open for same-day procedures. The day is quick paced but fun, and you get a lot of experience with ultrasound, MR, and stereotactic biopsies.
Hi, I'm Marissa Lawson. I'm a current resident and future fellow, and I'll talk to you about our diagnostic service. The morning starts at 7:30, and we first begin by reviewing cases of patients who will be coming in for an ultrasound. And we look up their prior images here at the PACS, 1 of 2 in this room, and we have 2 additional in our 2nd room. And once clinic starts, we use our GE or Hologic monitors to review mammograms. And on the diagnostic service, we prioritize diagnostic mammograms and screening mammograms of those who are waiting for their results. And I review the images independently before signing out my impression to the attending, and we decide from there what we'll do next with the patient.
I'm the fellow on Screen MR. My day starts at 7:30. First I come and preview the mammograms that were performed the day prior on our mobile mammo van. After that I read them out with the attending. I also am responsible for reading the MRIs for the day. Here's our Mri Workstation over here. Here's where we read the MRIs for the day. We have a robust MRI service, typically read roughly 8 to 10 a day, and the MRIs are primarily done for screening high-risk women and also extent of disease workup. I preview the MRIs, dictate reports, and after that, I read them out with the attending.
We work in close collaboration with our colleagues across the continuum of breast health. Through this door, we have access to breast surgeons, radiation oncologists, medical oncologists, breast health nurses, social workers, and patient care navigators to provide follow-up on patients referred to us from our colleagues and to receive additional clinical information about the patients we are currently seeing.
From the provider aspect, we are now on the other side of our reading room. The reading room is behind us, and our mammography rooms are on our left side here, as well as we have our supervisor and reporting office. As we move forward, space is limited in this hallway, but fortunately we have a lot of avenues to connect to our different areas. As you can see, after the mammography room, we've made it full circle back to our tech area. This is our MRI area on the second floor. As we enter our tech area, we can also see one of the two MRI machines that we have. One a 1.5 Tesla magnet and the other a 3.0 Tesla magnet. The one you see here is the 3T magnet. Both machines are capable of screenings and procedures. However, we almost always use the 3T in breast imaging.
We now take you down the street to the 1144 Eastlake Avenue East building. This is where our research and office space exist on the second floor. There are several free cubicles and offices on this floor where residents and fellows have their own space for studying or working on research projects. They also have access to research coordinators and imaging and scheduling personnel.
This section of the second floor in our 1144 building is entirely a part of our breast imaging team, including research and support staff. This facilitates research collaboration and collegiality. Here is one of our provider offices.
So I am Jake Sharp. I'm one of the current fellows. This is the academic space we use. We get an academic week about once in every 3. So you have your own space here where you can work on tumor boards, your academic project, various conferences. And it's nice to have your own space here. And then you're also very near, you're away from the clinic setting, so you don't have to be distracted, but you're also nearby. In case clinic needs you, it's easy to get up there.
As we keep moving down this hallway, on the left side is one of our reading room outposts for our radiologist. We have 2 in total. At the end of the hallway is our film room, where external imaging is processed and viewable for our doctors. We have multiple meeting rooms in the 1144 building, but this particular one is also connected to our break room. As well as the back entrance to the second floor of the building.
And we conclude the tour with a view of the lunchroom over South Lake Union. Thank you very much for listening to this tour.